you're still here. Great. I've got great news. Sylvia just left, but I gotta tell you this. We are running a flash contest starting now, and it's gonna go until July 31st. All you need to do is sell 25 hospital indemnity or dental, one product per belly button, so don't go doubling up on me, and you're gonna earn 100 points for our next convention. We just got back from Cancun. It was fantastic. Next year we're going back to Cancun to Hard Rock. Now, if you are an affiliate or an elite partner, you have to do 60. But between now and the end of July, hospital indemnity, dental, it's going to earn you 100 points of the 150 points that you need to be on our trip next year. So go after it. Stay tuned. We're going to do a lot of webinars. See ya.
Hi, I'm Sylvia Gordon with Sisters of Selling. Again, my sister has stood me up because she has a doctor's appointment. Nothing major, but I'm happy to talk to you today about the 3 different type of Medicare late penalties. So if you're a seasoned agent, you already know this, but if you're a rather new agent, it's nice to see it concisely handled in one graphic. So you can have late Medicare Part A. The penalty is 10% times twice the number of years you were late. I know. Medicare Part B is 10% for every 12-month period you were eligible that you did not enroll unless you had creditable coverage. Again, creditable coverage means what the law wrote, which was employer group health. Not VA, it's not creditable. Not COBRA, it's not credible. Not federal employee health benefits, it's not credible. What is credible coverage? Employer group health plan with over 20 lives, large plan. So if you don't have that, you're triggering the Part B penalty. And it's really unfortunate, but you know, if you've ever had to call Medicare, Social Security, or the IRS, or any government agency, you can get the wrong information. I have trained on that for 15 years, that you can call Medicare 3 times and get 3 different answers. So I myself called Social Security last year, and I had a client that was moving back from England. She'd been on national health care. And I said, if she's on national health care, is that credible coverage? Because I kind of heard a rumor that maybe it was. And Social Security, I put them on speaker so that my assistant can hear too. And she said, yes, if you live in a country with nationalized health care, that is creditable coverage. If you come back to the States, you won't have a late Part B penalty. So I looked and I could never find that to be substantiated anywhere on CMS.gov, on Medicare.gov. So we called back again this week. You know, you got to wait on hold when you call Social Security. 30 minutes minimum, 45 an hour is typical. Don't call in the afternoon, just forget that. So I called again. And I said, hey, this is what they told me. Is this true? And they go, no, that is not true. Creditable coverage is large employer group health insurance. And I was so mad because I had believed them and told my client with Social Security. I said, I just got off the phone with Social Security and this is what they said. Well, that was wrong. So now I had to call back my client yesterday. Her mom's still in England, hasn't moved back yet, and say, hey, you know what I told you? It's totally wrong. Humiliating. I should have taken my own advice. If you get something that doesn't sound quite right and you can't find it substantiated anywhere online on their website, call back again. Get another person, see if you can get the same answer 2 or 3 times. And like I said, it goes the same with the IRS. With Medicare, it's all the government agencies, okay? Not to bash them, they have their own challenges, but just you don't want to look bad to your client like I'm going to look when I have to call my client and tell her it is not credible coverage. The 3 years she has spent in England will be a 30% penalty when she comes back for Medicare Part B. That's why I like to tell my expatriates to try to keep Medicare Part B if you can comfortably afford it, because in my experience, they almost always come back when they get sick. They don't stay there when they get sick. Okay, then there's a Part D penalty. And don't you just love how these are all calculated differently? Part D is 1% times however many months you were eligible for Part D. And it's 1% times the national average price, which is, since we've had Part D in 2005, it's always been right around $31, $32. That's the national average price. And so it's 1% times that. Another thing, if you're a new agent, is the insurance company will collect this. It's like automatically built into your Part D price, but then they have to send it over to the government. The insurance companies do not benefit by this Part D penalty. They just have to collect it and send it on. The other thing is to remind your clients, these penalties are lifetime penalties. Unless you're on Medicaid, you don't have the penalty. But if you're getting the penalty not on Medicaid, they're going to charge it to you for the rest of your life. A lot of your clients assume that it automatically ages out. Like they think they age out of paying income taxes. It has nothing to do with age. That when they hit 65 or 70 or 80, they're like, now I don't have the penalty anymore, nor do I pay income taxes. No, myth. That's a rumor. You'll pay income taxes as long as you're making taxable income as a single person earning over $25,000. That's federal income taxes. States vary. You will pay the Part B penalty for as long as you have Part B, and D as long as you have Part D. Okay? For the rest of your life. If you have more questions, ask us in the comments below.